My name is Jessica Simon, and I am a second-year occupational therapy student at the University of South Dakota. I have had the best experience participating in the South Dakota LEND program. This experience has by far exceeded all of my expectations, and I believe that I have grown tremendously, both personally and professionally. If I had to pick one experience that was the most memorable, I would pick the real-life family experience. I was matched with a wonderful family in Sioux Falls, and I hope to continue seeing them long after I'm done as a LEND trainee. For future trainees, I would encourage you to be open to all of the experiences that LEND will expose you to. Make the most of your year in the program. I've truly loved every part of my experience as a LEND trainee. I'm so thankful for all the experiences I've had and for all the friends that I've made. I will carry all that I have learned with me as I embark on fieldwork and into my OT practice someday. Thank you, South Dakota LEND, for everything.
LEND has taught me so many things, but by far the best part has been learning how to work in interdisciplinary teams to best serve patients, and I fully intend to use those skills in my future practice as a physician.
Hi, my name is MADDISON, and I'm a second-year physical therapy LEND trainee. There are not adequate words to describe how thankful I am to have been a South Dakota LEND trainee. I have learned so much and gained numerous valuable experiences from participating in clinics, growing in my leadership skills, and completing a research project with the genetic counseling trainees. One of my most memorable experiences was the monthly LEND developmental clinic. It was so great to learn more about each discipline and come together as a team to make the best recommendations for a child and their family. To future LEND trainees, I encourage you to soak in each and every experience. It is truly a gift to be a part of this program, and I promise you will become a better person and provider because of it. Thank you to the SD LEND staff and my fellow trainees for a life-changing experience.
Hi, my name is Madison, and I am the Speech Language Pathology LEND trainee for this year. I'm incredibly grateful for the LEND program. I've met some awesome classmates, professors, and leaders in our healthcare field, and it's really fun to understand the importance of interdisciplinary care and collaboration between providers, family members, and patients themselves. I've really been grateful for the hands-on opportunities at the numerous clinics, and I also look forward to having continuous connections and support through the LEND program and the Center for Disabilities. So thanks all that helped me with this program, and I'm incredibly grateful.
Hi, my name is Rachel SCHMITZ. I am a second-year physical therapy student at the University of South Dakota, and I am a first-year LEND trainee this year. LEND was a great experience for me. My favorite part about LEND was the Thursday night classes because they were not only fun and interactive, but they really helped to remind myself of why I'm going to school to be a PT. These classes were a breath of fresh air because there were no strings attached. They were purely just for learning and interacting with people that you normally wouldn't get the chance to interact with. I think LEND really enhanced my knowledge of all of the other disciplines, and I'm certain that I will be a better clinician in the future because I now know who to refer to if I have any questions.
Hi everyone, my name is Colette. I am a clinical psychology trainee, and one of my favorite things about LEND has been learning how to be part of an interdisciplinary team and really getting some hands-on learning and learning from the other disciplines and working together on different clients that come through and the different cases that are presented. And also, some of us were able to go to Washington, D.C. for the Disability Policy Seminar, where we got to meet with some of our state representatives and learn how to be an advocate for people with disabilities.
Hi there, my name is Mitchell MUSKE. I am a genetic counseling LEND trainee. What do I want to say about LEND? LEND is exceptional. I have gotten the opportunity to learn so much from so many different perspectives. I've gotten the opportunity to work with some really great providers and learn so much from them and my colleagues and the rest of my cohort. I've gotten the opportunity to make some really deep, both professional and personal relationships, all things that I treasure completely. I've really gotten the opportunity to both grow and learn so much more, and it's been a great experience.
Hello, my name is REDIET YEMANE, and I'm the nutrition trainee. I'm a first-year nutrition and exercise graduate student at SDSU. I am originally from Ethiopia. Before joining this program, my knowledge about disability was limited, but after attending different lectures, observing clinics, and also participating in them, I think my knowledge has significantly improved. One of my favorite things that I got to do is go to DC for the annual disability policy seminar, which I learned from a lot. Aside from that, I made a lot of connections and good friends in this program that I hope to have after the program ended.
Hi, my name is Juliana KEANE, and I am currently a second-year occupational therapy student and a first-year LEND trainee. LEND was the absolute most wonderful experience for me, and I could go on and on about how wonderful it was, but I wanted to share one piece of advice for future trainees, and that would be to truly soak in every single minute of the experiences that LEND offers you. Meet new friendly faces, immerse yourselves into the knowledge that LEND offers, and don't forget that in order to be the best practitioner you can be, it starts with knowing and trusting in yourself and your capabilities. So wishing all of the best of luck to the LEND class of 2023.
Hi, my name is Elle Sturma, and I'm a speech-language pathology graduate student in LEND. One thing LEND has taught me is the importance of interdisciplinary care. From experiencing this firsthand in our clinic and being a part of a team, to observing other clinical experiences at Sanford, I have learned that a team approach to healthcare is incredibly important for all of our patients. And one thing that I will tell future LEND trainees is to be open to new experiences and take advantage of as many opportunities as possible through LEND.
My name is LIBBY FREEMAN, and I am the school psychology trainee, and I have really learned a lot from LEND, and it has meant a lot to me because it has really helped me discover what I want to do with my life and the individuals I want to work with. Let alone, it's helped me meet a lot of practitioners within this field already and make great connections within the community. I hope that future LEND trainees really dive in head first, ask questions, because everyone is here to help and wants to help you learn and grow as students. So have fun, and I hope you have a great year.
Hi, I'm Babs DIERINGER, and I am a clinical psychology student as well as a LEND trainee. It's going to be really hard for me to condense everything I want to say in a short video clip. But some of the most memorable things for me in LEND have been getting to interact with the kids during our different clinics. Kids can be really chaotic and all over the place, and that's kind of the whole fun in it. You never really know what you're going to get. I have also really loved the interdisciplinary aspect of it. It's really expanded the way that I view my own profession and the way that I view clients moving forward. So welcome to all the new students.
My name is Millie, and I'm a second-year genetic counseling student. My biggest takeaway from my time spent in the LEND program is the importance of multidisciplinary care. Throughout the year, I've been able to learn what other practitioners do to assess and provide ongoing care to their patients, which has provided me a deeper understanding of how different providers can work together to provide more comprehensive care for our patients. One of my most memorable experiences throughout my time in LEND was my family experience, where I met with a family throughout the year of a child who has a genetic condition. This experience provided me with additional perspective and empathy for families and what they may experience outside of clinic when meeting with me. My time in LEND has truly been impactful, and I would recommend it to anyone who's interested in becoming a well-rounded healthcare provider.
My name is Sam Wessels, and this is what I would tell future LEND trainees. I would tell them to speak their mind. Yes, not just about what they're learning, although they will be learning a lot, but also about what LEND doesn't know. Because there is still a gap between people with disabilities and the people caring for disabilities. And this is going to be your chance to bridge that gap. So if you have any knowledge at all, please share.
Hi, I'm Maddie, and I'm a social work LEND trainee. What I truly appreciated about LEND was learning how to work within a true interdisciplinary team and learning other disciplines, skills, knowledge, and abilities. What advice I would give to future LEND trainees is to take full opportunity of learning about the individuals, families, and community that we serve by attending as many trainings, conferences, and webinars as possible. Take advantage of those leadership opportunities. What I will miss most about LEND is the relationships that I built with my future colleagues. Thank you.
My name is Earl Swallow, and I'm a second-year clinical psychology trainee. My most memorable experiences during LEND have been the clinical experiences, especially hearing the stories of others and their experiences. The interdisciplinary experience will stick with me, and I look forward to utilizing this in the future. I really enjoyed seeing how disciplines overlap and how each contributed important considerations in developing diagnoses and supports for the clients. I was hoping to gain a better understanding of working with and for and advocating for those with disabilities. LEND met my expectations in every way, and in many ways I was not aware of coming in. I would tell future LEND trainees to really take in the opportunities provided and the knowledge the mentors provide. So the question is, why LEND? To be able to interact, learn from, and hear the stories of others, connect with other trainees, and to gain leadership development.
Hi, my name is Elizabeth KLOCKE, and I am a second-year occupational therapy student this year, and I'm also a LEND trainee. The most memorable part of LEND for me this year was learning about the personal stories of my classmates and bonding over pizza. It was very impactful to hear everyone's perspectives on life, and I enjoyed building strong relationships with everyone throughout the course of the year. I can confidently say that the relationships I've built throughout LEND will act as a resource throughout my professional career. I also appreciated how LEND provided the opportunity to gain the in-depth clinical experience and inside look of how to better the lives of individuals with disabilities and their families. LEND confirmed my passion of working with children and families with disabilities in an occupational therapy setting.
My name is Sarah, and I am the Parent Advocate Trainee for LEND Year 2021-2022. I have appreciated all the training that LEND provides for the trainees as it relates to understanding IDD. I've not only learned more about healthcare-related information for my own child, but I am further impressed by the desire for the medical LEND trainees to learn how best to care for and treat persons with IDD. In my son's 11 years, I have met medical professionals that I've had to go out of my way to advocate for my son. And I have met medical professionals that strive to do the best for my son and our family. LEND is an amazing opportunity for medical professionals and for us parents to see up close and personal the medical field at work in the IDD field. I am grateful for LEND giving me this opportunity. Thank you.
One thing I would tell future LEND trainees is to take advantage of all the opportunities available through LEND. There's a wide variety of experiences that'll help you grow as an individual and as a professional. My favorite experience was the Washington, D.C. trip, where I was able to advocate for disability rights at the federal level.
I'm Callie. I'm an audiology LEND trainee. This year, one of the things I was hoping to gain out of being in the LEND program was just getting experiences of working with individuals and families of people with disabilities. And LEND more than exceeded my expectations in that area. And then something that I learned through the LEND program that I'm going to carry with me in my future is the importance of integrating interdisciplinary teams into your care for your patients or clients.
Hi, I'm Patrick Wilson. I'm a third-year medical student at the University of South Dakota. LEND has meant a lot to me because it's gone above my expectations. I initially got involved in LEND to help me as a future physician to better treat those with disabilities. While LEND has provided this opportunity, it's also provided a chance for self-growth and development that I did not expect. I learned a lot from this program, and I also learned how to better connect with people on a fundamental basis. I was able to step further outside of my comfort zone and to treat people at all stages of their life. Overall, LEND has been an invaluable experience, and I will continue to use the many things that I learned throughout my life, both professionally and personally.